So I want to take a moment to talk about modeling and take us back to the very beginning of some of these decisions we made early on around social distancing. If you remember, as this was evolving, this is a pandemic of a scale that has not been seen in our lifetimes. And we went back, knowing what we were knowing, watching China, watching other countries, learning from the science. We realized that very early on we needed to be St. Louis and not Philadelphia. We've since seen other cities around the country and around the world that have taken different measures at different times, and that's made all the difference in their trajectory. Thinking about cities like Lodi and Bergamo in Italy, very geographically close, but taking some different decisions. And we knew it was so important way back from that national pandemic guidance, that plan about the non-pharmacologic interventions. Those were the Swiss cheese efforts, from limiting mass gatherings to closing schools to all the measures on social distancing we've taken. We said that none of them are perfect alone, that it really is like slices of Swiss cheese. When you layer them slightly over the holes with each layer, collectively that makes a difference. And what we now know here in Ohio and around the world is it truly works. But it's so important for us to think about this when we think about modeling. There's a lot being said about modeling right now, and it is not a science that predicts our outcome. It's our actions that predict our outcome. So when we made those initial decisions, modeling wasn't even available yet because there wasn't data yet to put in models. So remember that modeling is still like a weather forecast. And even weather forecasters don't use one model. They use multiple, and they take a wide range of things. And similarly, when we look at the modeling for this pandemic, we look at the most conservative worst case scenarios, and we heard some of that in our very conservative sort of Cleveland Clinic model originally. And we look at some of the other modeling that is showing much better outcomes. But it's so important, all these modeling do, all of it collectively, points us in a general direction of decision making that we can use to make some guesstimates about maybe when a peak will be, maybe when we'll need more ventilators than not. But it's very, very general directional science. It's important to think about worst case scenarios because what we want to do and everything we've done is rule out the worst case. Worst case would be having to make really hard decisions about scarce resources. We know we have large shortages of things like PPE and ventilators, and we are doing everything we can to never have to make that decision. But if we don't know what a worst case is, we can't aim well and we can't prevent that. And so similarly, we look at the best case scenarios and we're very optimistic and hopeful, but we have to continue to think about worst case scenarios. So let me show you our original curve. This is an oldie but goodie. Eric's moving, if you remember, our original curve. This was before we had modeling or any numbers that could tell us exactly where we would be in the future. But we had learned from all the strategic national plans, as well as the past, that if you do no social distancing, no Swiss cheese, your curve looks like this. If you do the very aggressive measures we're taking in this country, you flatten the curve and you spread it out. Now remember, you peak a lot sooner if you do nothing. But what you do, remember our black line, is that you overwhelm the healthcare system. And we've seen the sad experience of countries that didn't have the time that we have bought here in Ohio. We saw in Italy what that looks like. It's heartbreaking. We see some cities like New York really struggling to not have to face those decisions. So here in Ohio, right now, the good news is the efforts you are taking have kept us below that hospital capacity. We still have capacity in our hospitals from doing things like getting rid of elective surgeries. All of these are costly, painful measures, but they have kept us under this curve. In fact, right now our modeling is showing us even flatter than the blue in this original curve, stretching our peak out a little further. It's stretching out the onset of the spread of disease. But it's very important to remember that within 2 weeks, if we let up, within 2 weeks, we will easily bounce back above that curve. Vitally, vitally important, Ohio. You've done this. You're winning the war to protect our scarce resources and keeping our hospitals being able to deal with this. But the second we let our foot off the gas, the second we are no longer that Category 3 hurricane, it can pick up wind again and we can be a Category 5. I want to show you some other numbers. This right now, I'll go back, I'm sorry, Eric. This is taking a look at the onset of our measures. We are the yellow bar, and we're looking a little bit here at some other states, New York, Michigan, the United States writ large, Ohio, where we are now, we're this yellow line. Now, it's important to know that there was already the spread of this disease before anyone took any measures. We now know that asymptomatic folks were spreading it. We know now that some areas of our country were seeded earlier than others. Certainly if you have a lot more international travel and airport, when we look like a city like Detroit, we know that they're being harder hit right now. Ohio, they're just a little ahead of us on this curve. We're lucky because we all took measures. New York, Michigan, and we did. It's really, really important to know that New York's just a little bit ahead of us on the curve. They had spread sooner in a community fashion probably than we did, but we can go back and see the same kinds of things they're seeing. So we must. This is where Ohio is. We're a little flatter in our curve right now. We're spreading it out over more time, but we can't become complacent. There's something else to look at. Next slide. So this data, this is new, this is on our website because I know it's very hard to see on TV, but we also, even within our spread in Ohio, it's not going to be perfectly even. I keep saying we're going to have hotspots and flare-ups in different parts of our states at different times. And it's so important. We have to have these measures across our state. This disease spreads so rapidly, it's so lethal. But you can see that some of these things, the governor was mentioning, prisons, nursing homes, hospice care, VA homes that we have in our state, psych hospitals, places where people have to be close together for various reasons, are more at risk. They have more vulnerable populations. And you'll see some of that, and that's why it's so important that we are not spreading this disease, we're not spreading it to the workers in these settings who have to go in and come home. So everything we're doing is helping protect our most vulnerable, but we're starting to be able to see some hotspots, some flares that come with cases up near Detroit, around some nursing home issues we faced, around a prison, around some nursing homes in Youngstown. These are hotspots that'll flare up, they'll recede, they can flare up again. That's why we're building a hospital system alongside our nursing home partners to be able to triage the best help and resources wherever those flare-ups occur in our state. We're rushing PPE that we have to places that need it more. We'll be able to move ventilators to hospitals that need it more, and we'll be able to triage people if a hospital is reaching a capacity to a nearby hospital. All of that is the planning time that you helped us buy. Next slide. So we right now are this blue line in Ohio. Please, Ohioans, we've got a couple hard weeks ahead of us. It is the social distancing that we're doing. It is the sacrifices that we are making in our businesses, and they are painful sacrifices. We have hospitals that do a lot of elective surgeries that aren't getting the income that they would normally get. There's no business untouched right now. And we've got to know that the sacrifices we are making do not let up. They have to be worth it. If we let up, we will change our trajectory and look more like that original yellow curve. Next slide.